For the first time on SmallCapPower, we're with Dan Matlow, President and CEO of VitalHub, a company offering mobile app software for patients and clinicians. Dan, thank you so much for being here.
Thank you, Rachel.
So before we get into anything, let's talk about your background in the industry.
Yeah, I have over 30 years of experience in the commercialization of software products, mainly coming from a sales and marketing-based directions, but the last 25 years as CEO of various ventures, all of them that have been successful, and about 20 years of that in the healthcare space, primarily dealing with hospitals and long-term care homes.
Right, and now in your own words, can you go over the challenges facing the digital healthcare market right now?
You know, the healthcare market is continuously striving to improve in their, in their software and their development processes in many different ways. Only recently has it managed to digitize all healthcare records in hospitals and patients abroad, and now they're ready for the next opportunity, which deals in a lot of different aspects, but interoperability and making those applications work effectively so healthcare workers and clinicians and patients can effectively consume all that data in a really effective way and be productive.
And how big is that market?
God, there's lots of statistics. Whatever way you slice this is big. I think in the U.S. market alone, you're reading data on it, it's going to be a $230 billion marketplace that you're dealing with. So healthcare IT, we just recently came back from the HIMSS show, which is the big healthcare conference this year was in Orlando. 50,000 attendees that came to that show. So it's a big, big market, lots of potential.
Really good. Now, how is VitalHub's mHealth solution different from the other companies out there?
You know, mobility and SaaS-based, hosted-based applications, cloud-based applications, the trend in all sectors, and it's no different in the healthcare sector. Mobility is a big trend in that sector. Clinicians, patients, they all want to start seeing their information, being untethered. They don't want to have to go to desktops. They want to get those things on their phones and their tablets. So it's a big opportunity.
Right. And some people could fear that it's not safe. How safe or secure is the information on the mobile? You
know, the VitalHub platform, it's a software development platform. It started out of Mount Sinai in Canada. It helped get along through Mars Innovation. And took it along, but it's about 5 years of R&D that's gone into about $7 million worth of research that's done. And really what they've attacked is the problem of how do I get those clinical records to work together, and how can I consume those applications on these small phones or these tablets and do it in a way that we're used to, and we're getting used to with these native apps that are being used. So VitalHub helps build those apps in a really effective way.
Really good. And are there revenues currently, or are there plans to,
for sure.
to grow your sales
we got about 10 large customers that use that, and primarily in the British Columbia marketplace. I took over the company in the summer, and we're starting to put commercialization, a large pipeline that's being established with that. But yeah, there's about $400,000 already of recurring-based revenue, and the company does about $600,000 in revenue a year. So we're off to a quick start, and we believe with the expertise that I'm bringing, or the team's bringing on commercialization, that we can see big growth in that market.
Good, and I understand that you also have an M&A strategy. How is it driving your growth?
Yeah, we learned through my past experiences that getting customers, getting a customer base is an important element of doing that. We believe there's a large opportunity to start bringing together like companies in the healthcare IT space and start aggregating resources to get effective in terms of the marketplace. So we've embarked on an M&A strategy. It's a key component of the VitalHub strategy.
Very good. Now, what are the characteristics of those target companies?
You know, we're starting to look at lower downstream companies that have been around for a little bit of while that have an install base, like 60-70% of the revenue is already recurring in nature. They have customers that we can work with to sell the mobility platform to, because we believe all customers want to get to mobility platform. So there's an increased revenue stream that comes from that. So we're looking at that. We're looking where we can aggregate development resources effectively. One of the targets that we're looking for has an offshore development group that can be used for many different ways. To do it. As we start building the mobility apps using the VitalHub platform, we believe we can get that group trained to go produce those applications as that market, so we can work in that marketplace pretty effectively. And there might be some cost-cutting exercises that can be in terms of aggregating resources effectively with that.
Really good. And now moving on, you have a partnership with Microsoft. Can you tell our audience about that?
We believe the Microsoft platform is going to be an effective mobile platform within hospitals. Okay. The Windows 10 environment and the Azure cloud-based market are big markets that Microsoft's going to. So we want to align ourselves pretty effectively with that marketplace. So we've built some Microsoft Windows 10 Surface-based applications using the VitalHub platform. Microsoft loves them and is promoting them in their marketplace. So we recently at the HIMSS conference, we presented in the Microsoft booth. We were present in the Microsoft booth. And Microsoft has endorsed us in many of the accounts in Canada and abroad. So we're excited about that opportunity.
Very good. That's really great. Well, lastly, let's go over your management team. Other than yourself, what do you believe about your team, and how can you guys become a leader?
You know, with 20 years of experience in the healthcare IT sector, as well as the recent company MedWorks, which we started and founded, that was sold off about a year ago, we believe we have both the public experience as well as the experience running healthcare software companies pretty effectively. So Brian Goffenberg, who's the CFO, has joined me. Andre Vandenberg, who is the CTO at MedWorks, has joined me. We have other contacts in terms of being in the industry that we believe we can attract the elite talent from a commercialization and development expertise as we start aggregating these companies together to really effectively right-size these companies and make it effective. So we're excited about the opportunity as we bring these companies together, that we got an elite team that's going to execute, and both on the public market side as well as in the software development and distribution side.
Great. Well, thank you, Dan, for being here today.
Thank you very much.
To learn more about VitalHub, you can visit their investor hub on smallcappower.com.